You are not too young for heart failure. We are not too young to have heart failure. Hey besties! We're back for another fun-filled, wonderful episode. And this month is Heart Health Month. So in honor of that, we're wearing our red, blinking it out, you know. And so we decided to dedicate this webisode to Go Red for Women.
Let's be honest. I mean, we're young, we're vibrant. We can't have heart disease, right?
No, of course not.
Right. False. Yes, we can.
Your heart pumps to all the organs. You need it for pretty much every part of your body. I mean, when you're in spin class, getting it in, or, you know, at the club, trying to get it in. Yeah, your heart needs to pump for that. Or when it melts, when you see the birth of your new child, or when you see the love of your life and your heart skips a beat, or when he makes you mad and your heart is on fire. So we have to have more appreciation for all the wonderful things that our heart does.
The biggest misconception that we hear out there is that women don't get heart disease, and they also don't get strokes or heart failure, but that's just not true. Cardiovascular disease is killing 1 in 3 women. So that's a woman a minute that dies from one of these diseases. It's just out of control, and we need to do our part to make sure to get that number down. Even in our 20s and 30s and 40s, we can still be affected by heart disease.
So this is for you, our young, fabulously fierce besties.
Stay tuned.
So heart failure has many different causes. And what we commonly think of is a person has had numerous heart attacks, and over time their heart starts to fail. And they develop heart failure with the symptoms of being really short of breath. And you commonly hear people talk about there's fluid and water on my lungs. But yeah, that's the majority of people that have heart failures due to heart attacks. But there are a few less common causes, and more importantly, causes that affect young women that I want you to know about. So congenital defects are a big one. What it means are defects that you were born with, whether it be small holes in your heart or whether there is an issue with one of your valves. Most times these defects are very small and go unnoticed for the majority of your childhood. It's not until extreme stress or strenuous circumstances that they begin to show themselves and they're noticed. Well, those defects over time can lead to heart failure. Another big cause to mention is after childbirth. It is called peripartum cardiomyopathy. They don't really understand why. Some say it's due to hormones, but who really knows? And you can develop some heart failure symptoms related to it, your pregnancy. Another one is related to grief. Under times of having deep grief, for whatever reason, you can go into heart failure. Those occasions, though, seem to be reversible once you get over the moment. Heart failure is a silent killer. Oftentimes, people walk around without knowing anything is wrong. Usually the first indication is fatigue. There are other symptoms, such as difficulty breathing while laying down, swelling in your legs, increased weight gain, or sometimes just a dry cough can be the first indicators of heart failure. But young people especially are inclined to brush that symptom aside because of their ever-changing lifestyles. The birth of new babies, for instance, changes in jobs, scheduling time due to schooling and other events. All of these can take precious sleeping hours, and if prolonged for lengthy periods of time, can result in fatigue. So you think that's what all your symptoms are related to. And don't be too hard on yourself. Even physicians also may not diagnose a young person with congestive heart failure, simply because it is more common in the elderly population. And they don't think to look for it in young people who appear pretty healthy.